Now, in this session, we're going to code a spine procedure. And if you can recall when studying spine surgeries, you might remember that there could be multiple procedures, such as decompression procedures like a laminectomy, a vesicectomy, a foraminotomy, discectomies. You could code for spinal fusion procedures such as arthrodesis. You got to code for instrumentation. You have to code for grafts, bone grafts. These are some of the procedures that you'll need to code for. And I went looking for one for us. So on YouTube, I saw this really neat simulation of a posterior lumbar interbody fusion. And I said, I want to code that. So shout out to Atlantic Spine Center. I wish I could play um, they had a video that was just incredible. It was only a minute and 47 seconds, but it was incredible. So it's left up to me to simulate, and I'm going to apologize in advance. Thank you. All right, let's get started coding this posterior lumbar interbody fusion. All right, so essentially, when a PLIF takes place, this is for treatment, and the intention is to restore the disc height. As you can see, the disc is kind of compromised. It looks like it's crushed or squished a little bit, and if you compare it to the disc at the bottom and the top, even the color looks off, and it's showing that something is not right. Also, too, if you look at the nerves, too, the nerves, are red here, and that is suggesting that there is some nerve pain. So this patient is probably in pain. So a PLI interbody fusion technique is going to take place, and essentially it's going to take place in this lumbar region, right? Yeah. So what do you do? Well, you got to open the site, the surgical site, and it's opened from the posterior, the back, right? A 4-inch incision, and the initial posterior fixation is applied right here. And they also use the posterior fixation to expand the intervertebral space, the disc space. And they're also going to attach these posterior fixations at the end, and you'll see it. And then parts of the vertebrae are removed, and you can see the lamina being removed. See? After they remove the lamina, they move the spinal cord over a little. And I tell you, that person better be asleep because that will be painful. Anytime you touch, the slightest touch to a nerve is painful. So they retract the spinal cord. Then they begin to incise the diseased disc. See the little incision they're making? I'm going to show you a view from the top. They took out a piece and then they kept going until they went as far as they needed to remove the diseased disc. When they finished, then they prep a biocompatible polymer implant. They prep it to insert. And before they insert it, they apply graft. That's bone graft mixed with blood. And they put it inside that implant, and the implant is placed into the disc space. And it sits like this. Then the procedure takes place on the other side of the disc where you see them retract the spinal cord to the right, and they carry out the procedure again. Then both implants are placed, and then they add more bone graft and until they fill up the space completely. Then posterior fixation pedicle screws are applied for additional support. Then, after a while, the bone from the vertebral column grows over the surgical disc, and it looks like this. And there you have your posterior disc fusion procedure. Now, it's time to code our procedure. You ready, coders? Let's do it. Of the following answers, which best describes the encounter? A. 22612, 22614, 63017, 59 modifier, 22842, 22853, and 20936. B. 22633, 22614, 63047 with a 59 modifier, 630 48 22842 20936, and C 22633 22634 63047 59 modifier 63048 22842 20936, and D 22612 22614 63047 59 modifier 63048 22842, 22853, and 20936. A 67-year-old female with lumbar spondylolisthesis and disc degeneration underwent a posterior lumbar spinal fusion at L3 through L5. A laminectomy was performed at both levels for decompression of nerve roots. The surgeon placed posterolateral bone grafts within biomechanical implant synthetic cages at both levels using autograft harvested through the same incision. Additionally, segmental posterior instrumentation was used, spanning L3 through L5. The procedure was performed through a single posterior approach, and intraoperative fluoroscopy was used for hardware placement. Okay, coders, I know your time is up and you may need more time. I know I would. So make sure that you pause the presentation, press play when you're ready. How did you do, coders? Okay, coders, if you need more time, take as much as you need. All right? So if you need more time, just press pause. Then press play when you're ready. Okay, coders, how did you do with your inventory? I'm speaking a little slow so I can give you a little more time. All right. Well, my inventory is pretty long. I have 9 elements on my inventory list. And it begins with the diagnosis, lumbar spondylolisthesis. And if you don't know what this condition is, it's when one vertebrae in the lower back slips forward over the vertebrae below it, causing disc degeneration. So our second diagnosis. And yes, if you were coding diagnoses, you wouldn't code the disc degeneration typically. All right, now let's look at our procedures. We have posterior lumbar spinal fusion at L2 through L5, and you notice I put 2 spaces. When we're talking about spaces, we are talking about the discs. Next, Laminectomy, 2 levels, right? So the lamina, we're thinking about the hard part, the vertebrae. 2 levels. All right. Now, for decompression of nerve roots, you see I put decompression in all caps because this is important. Some codes code for decompression or not or no decompression. So it's really important that you pay attention to that. Also, posterolateral bone grafts. All right, so there was grafting. Also, there was a biomechanical implant, in fact, synthetic cages. Number 8, there was an autograft. So that bone graft was an autograft. It came from the patient. It was harvested um in the it says through the same incision. So it came from the patient. And number 9, segmental posterior instrumentation, L3 through L5, and that is 3 levels. All right, coders, let's go ahead and let's talk a little bit about what we're coding. So you're going to be coding for the fusion, the arthrodesis, and that's going to come from the musculoskeletal section. Then I just kind of gave it away, huh? But that's just what it is. Now you know, right? You know it. Okay. You're going to code for your laminectomy, discectomy. You're going to make sure you acknowledge the decompression. Anytime you're talking about decompression, you're talking about the spine, right? Also, your posterolateral bone grafts, your implant, your autograft, and your instrumentation. You got to code for all of them. And those guidelines are going to come from the nervous system. So when you're coding for laminectomies, I would look at those guidelines. It tells you that you need to specify that approach. And I'm telling you, if you specify the approach, you're halfway there. Is it anterior, posterior? Is it lateral, etc.? Also, identify if it's an otomy or ectomy, right? We got some ectomies here, right? And then count your number of segments or spaces, because you got to know what you're coding for, and indicate the spine location. Where is it? On your cervical, thoracic, lumbar, or sacral? We're on the lumbar. Also, pay attention to your parenthetical language and chun your families and make sure you indicate your segments and your spaces. And decompression on the same segment as posterior lumbar interbody fusion is coded separately. And it tells you to use codes from this section. And then the musculoskeletal section, it tells you when you're coding for spine surgery, you got to know the approach. And then they have a coding tip. Oh, you got to know the approach and you got to pay attention to your definitive procedures like your arthrodesis. There's arthrodesis, which is fusion, instrumentation, your bone graft, and the number of segments and discs. All right. So arthrodesis must be coded with instrumentation. Just a lot of little tids, which you can kind of figure out as you're coding. You really can, but I think you need to know some things, and that approach is excellent. You got to know your approach. Now, let's go ahead and code. All right, before we get started, I just want to point out my observation. When you got these long answers, sometimes you just kind of have to make it make sense. And I'm going to just point out that A and D have the same primary code. and B and C have the same primary code. So my intention is to eliminate 2. So when you figure out which one is incorrect, which code, is it 22612 or 22613, then you've eliminated 2. And then we can get to work. Right. Okay. All right, so let's start with 22612. 22612 parent is arthrodesis, and we do need to code for arthrodesis, right? Spinal fusion is arthrodesis, and it's posterior or posterolateral technique, single interspace. So this is going to be for the first interspace or the space. Lumbar, 22612. I like it. I don't have any reason not to like it. And 22614 is the additional interspace. So A and D are okay. Now, my goal is to see if 22633 is better, right? So let's read it. Arthrodesis combined posterior or posterolateral technique with posterior interbody technique, including laminectomy and or discectomy sufficient to prepare interspace other than for decompression. Well, I saw something that might give me a little pause because I don't see um, this interbody technique in my list. But what stands out is other than for decompression. So this procedure is not to be used for decompression. And remember, I told you to put it, capitalize decompression for decompression or not for decompression. It's important because sometimes it could be the game changer. And this is the game changer. Boom. So we can eliminate 22633, B and C. They got to go. They're distractions. Now let's continue. All right, so we know that our primary codes are okay at A and D. Now let's turn our attention to the second code, and this might tell us a lot more because the second codes are different. 6301759 modifier at A and 6304759 modifier at B. So I'm going to start with 63047. This is the code for the laminectomy, fastectomy, and foraminotomy, unilateral or bilateral, with decompression of spinal cord, cauda equina, and or nerve roots. Lumbar. I don't like this code. I'm going to give you a moment. Go ahead and type in the chat and tell me what's wrong with this code. If you said that this fastectomy and foraminotomy was not carried out, that is correct. It's not mentioned here. We just can't assume that it was, right? We code what we see, and it's not here. So I'm going to eliminate 63047D, and A is my answer. But let's go ahead and do our due diligence. What if A is incorrect too? Then we have to choose the best of the 4. All right, coders. So let's look at A. 63015 is the parent. Laminectomy with exploration and or decompression of spinal cord and or cauda equina without fastectomy, foraminotomy, or discectomy. More than 2 vertebral segments, lumbar. Okay, coders, that has to be it. All right. So I am going to eliminate D, but I'm going to do my due diligence. I'm going to continue. Let's look at 22842. 22842 is your posterior segmental instrumentation, 3 to 6 vertebral segments. And if we look down, we've got segmental posterior instrumentation. We had 3 levels, 3 segments. So we can use this code. This is a good code. Also, 22853 is the code for insertion of interbody biomechanical devices, synthetic cage, and that is number 7. And finally, 20936 is the code for autograft for spine surgery. So that bone graft, and that includes harvesting. So coders, this is our code. It is the best of the 4. Now, when you look at these procedures, another tip is to make sure that you read. If you're not sure, read your parenthetical guidelines. It tells you use 20936 in conjunction with 22612. Yeah, so it's telling you, it's guiding you. If you're not sure, read the parenthetical guidelines. You should read them anyway, right? Okay, so we're going to eliminate D. A is our answer. And coders, if you said A, way to go, way to go, way to go. Now let me go ahead and conclude, right? So, just so you know, we have a lot of procedures going on. So I just want to reiterate what took place. We had laminectomy with decompression. So that's the removal of the lamina. We had, and we coded it 63017 with a 59 modifier. We also had a bone graft, right, with implant. So the brown piece is the implant, the gold bone graft was applied, and 22853 and 20936, and posterior instrumentation was applied. Now, this is only 2 levels, but ours would be 3 levels, 22842, and arthrodesis took place. What is arthrodesis? It locks it in for good. It fuses the vertebrae to eliminate movement at all. And we coded it 22612 and 22614. And we sequenced it like this: 22612, 22614, 63017 is with a 59 modifier. And if I had my way, I would append 51 modifier, but that's not here or there. This is what AI says, but I say 51. 2280, excuse me, 22842, 22853, and 20936. Remember, coders, everything is not going to be perfect. It's not going to be perfect here. It's not going to be perfect on your exam. And if you expect perfect, then you're setting yourself up. Don't do it, coders. Don't do it. Remember, your task is always to pick the best of the 4 when taking the exam. Now, when you're not taking the exam, you better believe you strive for perfection, right? Okay, so I got a gem. No, not a gem. I have 3 gems. Remember this, coders. When coding spine procedures, you're going to have a lot of codes. So make sure you're coding exactly the procedures carried out, and read forensically. Make sure you pay attention to those parenthetical guidelines. Number 2, you must always code instrumentation with arthrodesis or fusion. Always. They go hand in hand. And finally, pay attention to that decompression language. All right? It's gold. It's going to guide you. All right, coders. So if you got anything correct, that is outstanding. I'm proud of you. But if you learned something, that is priceless.